Hello everyone, I'm Kibin Alleyne and today is Tuesday, October 29th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Observed each November, American Diabetes Month raises awareness about diabetes, its impact, and the importance of prevention and treatment. Various health organizations, including Montefiore Einstein, will host events, campaigns, and educational activities to engage the public and spread awareness. Dr. Edwin Torres of Montefiore Einstein joined me to discuss their efforts. Doctor, thank you so much for joining me.
Good morning. Thank you for having us.
Now, I want to jump right into it. Can you tell us a little bit more about how diabetes is affecting, so many Americans? With that, how many people are affected, and why is that number growing?
The prevalence of diabetes in the United States, we have about 37 million Americans who have diabetes. So when we look at that into a percentage, it's close to 11% of the U.S. population. One in five Americans do not know they have diabetes. It's about 20% that don't know they have the disease. This is a big number. It is very important for folks to get screened so they can find the status. The question as to why this number is growing, this has to do with a multifactorial effect that has happened. We call it like a tsunami. We have an aging population. We have a population that's also suffering from an epidemic of obesity, and we also have health disparities that continue to plague our healthcare system and society. So when you combine all these three, it's a perfect storm for diabetes.
Now, as you mentioned, there are some people who may be living with diabetes and have no idea. With that, what are some signs and symptoms of diabetes?
So some of the signs and symptoms for diabetes, sometimes patients they take it for granted. They starting to urinate more, they starting to feel more thirsty, sometimes they might feel a little tired, sometimes you have a wound that is not healing. When you have those symptoms, it's very important for you to get checked by your providers because these are signs of an elevated blood sugar. So you have type 1 and type 2. Type 1 diabetes is more of a emergent diagnosis. Folks, they develop it and this is a very abrupt diagnosis. Type 2 is more insidious. So a lot of times patients will have type 2 diabetes for years and will not even feel that they have the sugars.
Now, how can living with diabetes alter one's life?
It can alter in many factors, right? Your life from day to day, now you're going to have to take medications. Now we're going to have another expenditure if you have copays that we're going to have to take care of. And also we have to think about the psychological burden that brings to somebody. Many patients, they know somebody with diabetes, it's very prevalent in the community, and we hear that folks lose their vision, they lose their foot. So when one gets diagnosed, that brings a lot of stress. But if we get taken care of early, we can, be very well managed and make sure that we live a long, healthy life with the disease.
Now, when we talk about diabetes on a larger scale, how it's affecting our country, but I want to take a look at New York City specifically. Which communities in our city are most affected by diabetes?
So the Bronx, we have a higher burden than all the other boroughs. The prevalence of diabetes in the Bronx is about 16%. When you look at New York City overall, that the prevalence is 12%. And when we look at the state, it's about 10%. So when we look at a community like the Bronx, we have a lot of disparities, housing, access to healthy foods, and also unemployment. So all these together, coupled where we have predominantly communities of color, Latinos, African Americans, and new immigrants, this is a perfect place for diabetes to thrive. And this is why we're trying to decrease the burden in the community.
And with that, would you say those are some risk factors associated with, being diagnosed with diabetes?
Yes, we call them the social determinants of health. These are factors that we know that are not, just inherent to your genetic makeup, to your family history, but these are factors that come from your community, from the outside, that still impact you.
Now, what are some challenges people in the Bronx may face in regards to diabetes? We know that people in the Bronx are unfortunately have more exposure to, being diagnosed with this. But what are some of the challenges that, people from the Bronx that may face, while this is happening?
There's a lot of challenges in the Bronx. Having access to healthy food. In the Bronx, we have the bigger center of distribution for produce for New York City. But when you go to places like the South Bronx, folks might not have access to healthy foods. So we have to make sure that folks do not live in a food desert. We call them food desert because when you go there, you're not going to have access to fresh, fruits and vegetables. The other is that, unemployment is a big factor, housing is a big factor. So coupled with that, and also folks that want to exercise but might not feel safe going out at night or in certain hours, that contributes to this, pandemic of diabetes.
Now, when we talk about diabetes awareness, we talk about prevention, but I want to talk about treatment and what people living with diabetes can do to live a healthier lifestyle. What some advice would you give to people who may be living with diabetes or nearing the spectrum? What can they do to kind of live a healthier lifestyle?
So it's very important to understand your diagnosis and to also seek help. At Montefiore, we have the diabetes prevention program. Those are for those folks who have prediabetes, and we have a program that is trying to help you prevent the diagnosis. This program is very successful. Those who have diabetes, we also have a program that's called the Promise Program. And in this program, they guide you through and make sure that you have a solid education to understand your disease. It's very important to have a very good foundation, because in the day and age of social media, it is so easy for folks to get misinformation and for that to influence how you're going to carry your disease. And the number one thing that we want is for the patient to be educated and to treat themselves, because if you treat your disease, you'll be able to live a healthy life.
Now, I'm so glad that you mentioned social media. I think that a lot of people use it as a tool to kind of help them on their journey, and it could be helpful. But as you mentioned, there's a lot of misinformation. What are some things people should look out for that may be red flags that they'll see on social media in regards to health, eating, and all of those things that can contribute to diabetes?
Some of the red flags is that, the motive, right? Sometimes folks are trying to sell you a product or direct you to buying a product. A lot of the influencers that we have nowadays, folks, they get paid so they can promote certain things. So the best thing for folks to do is to go to reliable sources. You go to the CDC, you go to the Department of Health, you go to Montefiore, where we have reliable source of information that we can provide you, because these are the places that they want to make sure that you stay healthy.
Now, I know that you mentioned some programs. Can you tell us a little bit more about the programs that are specifically for, Diabetes Awareness Month and, what's going on with that?
Oh, we're very excited. This is something that, we start working at the beginning of the year, and when November comes, we all get very pumped, right? We get very happy because we're ready to bring a lot of resources to the community. We have close to 30 different programs. They will be accessible in person. Some of them will be virtual for the community. These programs, they vary from nutritional counseling to more complex, to teaching you about the medications, the disease, and also mental health. So if you go to our Montefiore website, Diabetes Month website, you will be able to see all the programs that we have, and also addressing mental health. That is a big component of why folks, are struggling to manage their diabetes.
Now, with everything that's going on, with all of these, activities, I think it's great. But I'm curious to know, how does Montefiore aim to empower the community during American Diabetes Month? I do believe that education is an avenue to power, of course. But how do you hope this will empower the community that goes out to these events and learns a little bit more about their health?
So we're trying to empower the community. This is a big word, right? Empowering. So our theme this year is Empower and Connect. We're trying to reconnect the patients with the healthcare system. They can come to us and learn of the resources that they have, because a lot of times you will have these programs right on your backyard. And what good are these programs if you don't have access to them, if you don't seek for them, if you don't understand them? And we want to not only bring the patient, but also bring the family, and also be a resource for those in the community, for those providers in the community who might not have those resources, to come to us and reconnect, and we can help them help their patient live a healthy lifestyle. So with that, the message that we want to bring to the community is, seek for the resources that you have, because there's a lot that we're offering. We want to make sure the community takes advantage of it.
And can you quickly just let everybody know if there are any screening efforts where they can go to screen to see if they, may be a part of that population that's at risk?
I would say go to Montefiore Diabetes, Month. We'll share the website with you so they can have access to it. Click there and you'll be able to see the full spectrum of all the resources that we have, not only for screening, but you might want to just get educated because you know a family member who has diabetes. And a lot of times that education helps a lot to just, help the family member who's struggling with the disease.
Well, Dr. Torres, I want to thank you so much for joining us and having this conversation.
Well, thank you for spreading the awareness with us.
For more information on American Diabetes Month events by Montefiore Einstein, visit the website that appears on the screen below. Don't go away. We'll be back with more Open right after this.